Guys, my name is Isaac Simple and Real. Thank you for tuning in to my channel. This is a channel where we talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we usually say that being positive about HIV is not necessarily being HIV positive. Thank you. Today, allow me to talk about things that when you see them, you should consider to be tested for HIV infection. Number two, I'll also be talking on process of HIV testing, either by your HIV testing provider or clinician or doctor, attending doctor, or when you are doing it by yourself at home. Please sit back and enjoy. Now, HIV management has improved to a great deal, and currently we have evolved from back in the days in the 2000 to 2009, when we used to have antiretroviral drugs that if you are taking the ARVs, anybody could know that you are taking them because of the side effect that usually manifested on the patients who used to take these drugs. However, with the current research, we are now getting to more better drugs with lesser side effects and more adaptability. Although in HIV management we have not achieved cure rate, in the process we've been able to manage it to an extent that a person having the virus cannot transmit it to another person. So we are cutting on transmission. Now, I know you have heard about the incoming injectable antiretroviral drugs, the likes of cabotegravir, rilpivirine, and these drugs, it's true, they are coming. Actually, according to the NASCOP report, they are already in Kenya. Other countries have done piloting, and even FDA approved it to be used in Kenya. So you'll be seeing the pilots happening in our facilities. But that is for those who are HIV positive, and also as a preventive, the PrEP for injectable PrEP. And remember, these injectables are working like family plannings. And as I usually tell my clients, I take ARVs as a family planning method. Why do I say so? Why do we take family planning, especially for women and also for men? Why do you take family planning? The reason why you take family planning is to control reproduction. The same applies why do a person suffering from HIV take ARVs, is to cut the reproduction of viruses inside their bodies. So it takes the same technique. Currently, the tablet that is being used as a first line drug in the management of HIV, we are using a combination of tenofovir, lamivudine, and dolutegravir. These drugs, the triple therapy drug, single tablet, that is the FDC tablet of TLD, its main role is to cut replication of the virus, and also to ensure, actually the main reason is to prevent the replication of this virus, because the life cycle, these drugs acts on the life cycle of the virus so that it does not replicate to more viruses. And that's why we assess the achievement in HIV management by checking on your viral load. However, with all this having on our fingertips, we have realized that most people get signs of or symptoms of getting tested, but they do not pick these signs. And that's why I'm going to talk about the signs. When you come across them, please visit a healthcare facility, engage a doctor or a HIV testing service provider and get tested. Number one, sexual contact. One sign. If you have you had a sexual contact with a person, either you do not know their HIV status, or they have told you they are HIV positive and they are currently not on treatment, or they are not virally suppressed, please get tested. Another sign, if you as a person have realized that you are frequently getting some flus that you used not to get, or maybe you've been getting some dermatological rashes or dermatological conditions that are unexplained. Today we are treating you on skin fungal infection. Tomorrow we are treating you on pruritus. The other day we are treating you on pharyngos. The other day, you see, there is a sequence of skin infections. It could be your immunity is going down, and one of the causes of your immunity going down could be a HIV virus. Remember, a HIV virus is human immunodeficiency virus. So if it's an immune deficiency virus, it could be one of the reasons. So it's a sign that you need to get tested. The other reason for you to get tested is if you as a person, you have been engaging in unprotected sex with several sexual partners, or maybe you are suspecting that your spouse is having a sexual partner or an extra-sexual partner. So if you suspect your spouse is cheating, or you yourself you are cheating, and you suspect that your sexual partners could be having other multiple sexual partners, I think it's the right time for you to get tested. And in this case, you will not just get tested, but also you will either benefit from regular PrEP or event-driven PrEP. Why is this important? Because if you are being tested and you benefit from either event-driven PrEP or regular PrEP, you will lower your chances of acquiring the virus. So as you consider your behavior change, or you consider leaving your spouse, or you consider making up with your spouse so that you can agree on the issues, at least you are safe from getting the virus. So we will be cutting on the spread of the virus. Remember, the goal in the HIV management is to end HIV new infections by 2030. So if you are ending new infections by 2030, that means you as a person must have reduced it way before 2030, so that others, as they continue reducing it or mitigating it, we will be at par. Another thing, or why you need to be tested for HIV, is getting flu, especially common cold. There are those people they get common cold and they appear like they are suffering from severe malaria. They cannot even walk. They cannot come out of the bed because of just common cold. It could be the common cold is pushing you so hard because your immune is not strong enough. Your immunity is not strong enough to be able to fight it. So, what should you do? The best thing, first of all, confirm if you are HIV positive. And how do you do this? By getting a test. We'll be going to the test. Just calm down. Now, why is it important for you to get tested? Someone may say, if I'm positive, I'm positive. So why do I need to go and get the test? If I'm negative, I'm negative. Why do I need to go and do a test? Remember, if we test you and we realize that you are positive or you are having the virus, number one, you will be initiated on care immediately. And what's the benefit? One of the benefits is that your immunity will start coming up. So the likelihood of you getting this opportunistic infection will go down. Number two, your virus will go down. So at least your body will start coming up. The other thing on why, remember, these drugs have been offered for free for the longest. But remember, if you get an opportunistic infection, let's say you get cancer, what we call the Kaposi sarcoma. If you will require a chemo or maybe to see a dermatologist because of Kaposi sarcoma, remember there will be cost. And sometimes, as you know, cancers and the insurances, medical insurances, are not friends. So it will push you to calling up for harambees and pay bills. So you don't need this. Number two, also there are chest conditions like pneumocystis jirovecii pneumonia. Yeah, it's a condition that can get you. It's an opportunistic infection, yes, but the drugs are not free of charge, so you'll need to pay them for them. So you see all these things, they come if your immunity is low and just because you ignored to take drugs to improve on your immunity and suppress the virus when you had chance. The other thing about this, remember, we are doing this for our own self. If you take these drugs very well and you happen to get a spouse who is HIV negative and you are virally suppressed, even if they do not have to take PrEP, you cannot transmit the virus to them and you'll be able to raise children who are negative. So you'll be raising a HIV negative family which does not necessarily require to take medication to live with you. And also, you'll be lowering the burden of the government to purchase these drugs. Are we getting each other? Thank you. Now, the other thing that is coming up is that, especially for Kenya, the government is going to start to charge these drugs. So you'll be paying for them. Now, how is the government going to charge you? The government has provided an opportunity for you to procure an insurance cover so that from the next financial year, as they launch the Social Health Insurance Fund, they will be purchasing these drugs from the money that you have remitted via your insurance. So your insurance will be used to purchase these drugs. The way that antihypertensive drugs, we use medical cover. The way the hypoglycemic drugs, we use a medical cover. Also ARVs will be the same. So if you do not have a medical cover, it's very important you get one, because imagine you go to a comprehensive care clinic, you say I want to refill my ARV drugs, and then the clinician or the person at the registration tells you you will not be able to refill your drugs today just because your medical insurance cover is not up to date. And remember, health is personal. Health is not government. Health is not county. Health is personal. So if it's your health, then you got to pay the bills for it. But see, you had these signs, you did not manage them properly, and woe unto those who have your spouse and kids. You'll have a bigger burden. So for us to be able to mitigate on this, it's the best thing that if you see these signs and you have not been tested, please go and take your test. If you know your HIV status and you know you are HIV positive, there is no shortcut. Go and restart your medication. This is the only way out. Now let's go to testing. How do we go about HIV testing? We have two methods. Number one, we talk about the use of oral quick test. Is a simple method that you can do it at home. And also we have another one that we use this kit. Let me open it so that you can be able to see it. Yeah, using this kit. I know you are familiar with it, and it's the gold standard in the management of HIV. And this test, most government facilities, they are free of charge. Private facilities range around 100 bob. So go get tested, and after you get tested, I believe you'll be able to make a sober decision. If you have gotten an exposure, that is a HIV risk, either sexual exposure, needle prick exposure, sharp object of exposure, any other exposure to a risk that you suspect could lead you to HIV infection, please go. If it's within 72 hours, go get a test and get post-exposure prophylaxis. If it's other ones that I have talked before, go and take your PrEP. Are we together up to this point? Thank you. So that's what I had for today. Go and follow me on my YouTube channel, and in my next video, I promise I will talk more about the incoming Kabiri, or what we call cabotegravir and rilpivirine injections. Just keep posted. Thank you.